By the end of April, the city of Chicago had shut down 6 of its 12 public mental health clinics, in a move that has sparked outrage among the city's mental health clients and advocates. On Saturday, May 19th, hundreds of demonstrators marched on Mayor Rahm Emanuel's Northwest Chicago home in the latest of a series of actions targeting the city's budgetary decision that they say is creating a crisis for many of the city's mental health patients. Mayor Emanuel insists that the plan is not about cutting back on services, but rather consolidating and expanding available care.
I want people to remember, I take the issue of providing benefits and care to those who need mental health benefits seriously. We're not pulling back from service. In fact, we're giving more service to more people, and we're adding a new benefit.
Under the city's plan, uninsured patients will continue to receive care at the remaining 6 public facilities, while those with insurance will go to a number of private sector care providers. The move will save the city an estimated $3 million per year, though Mayor Emanuel has insisted that the decision is not about money, but improved services.
How do we fix the deficit?
Kelly Hayes of Occupy Chicago insists that the decision to close half of the public clinics is part of a move towards privatization that will restrict the availability of care for the city's most vulnerable patients in need of mental health services.
This is an ongoing austerity issue. It is a march towards privatization that the city has been fighting for years. Initially, they said, tough choices, budget cuts, we have no choice. This is what has to happen. When we continuously pointed out that they managed to find $1 million an increase for lawn mowing services and graffiti removal, and that $3 million is a drop in the bucket in a $1 billion budget, they said, oh no, it's about providing better care. Their talking points keep changing, but the reality remains the same.
The Occupy movement has joined in on the fight to save the clinics that has largely been led by the patients themselves. Care recipients and advocates have been engaged in a number of ongoing protests and public awareness campaigns, and at one point, a group attempted to barricade themselves inside and briefly occupy the Woodlawn Mental Health Clinic, which was slated for immediate closure in April. They have maintained a constant vigil at 2 of the closed centers, and also demonstrated outside of City Hall and more recently in front of the mayor's home. Several dozen people have been arrested in a series of actions. Linda Hatcher used to be a client of the Woodlawn Mental Health Clinic before it was closed in April. She and others are worried about the effects the closures are having on those who have been unable to relocate or adjust to a new caregiver at a different site.
Since they lost some of the clinics, some of the people are getting on drugs, some of the people are getting high, some of the people are drinking, some of the people are not in their right state of mind, some of the people don't even have their medication, and they don't have their therapists that they can go and talk to, that they can have someone to reach out to them.
Some worry about the costly impacts that the closures could have on emergency rooms and jails, which will be forced to absorb and provide care to more patients with mental health problems. Dan Bader used to work as a clinical therapist at Northtown Rogers Park Mental Health Center before it was closed in April. He has since relocated to one of the remaining open centers, where both himself and a large influx of uninsured care seekers have already been feeling the pressure of the center's increased caseloads.
When they shut down the 6 clinics, they also laid off about 40 to 45% of the clinical staff. So those who remain are going to immediately have huge caseloads. I have about 60 people, for example, who I do not know that are coming from therapists who have been laid off. These consumers, these clients are very upset about that, and now they have to try to adjust to me, and I have to get to know 60 people at once. Plus, we have new people coming in from the neighborhoods who also want services. And I had about 30 or so that I carried over with me from Northtown Rogers Park. So I have a baseline of about 90 clients, which will continue to grow. It's very hard to take care of people effectively and efficiently when there are so many.
On May 25th, the Illinois legislature approved $1.6 billion in Medicaid spending cuts as health services for Chicago's poorer populations continue to face the chopping block under city and state budget austerity measures. Reporting from Chicago, this is David Doherty with the Real News Network.